Hi, my name is Tony Sandset and I'm a research fellow at the Faculty of Medicine at the University of Oslo, and there I work at a center called Center for Sustainable Healthcare Education, as you can see right here. I work primarily on sustainable development in relation to health. And today we'll talk about, as it says here, sustainable healthcare education and sustainable healthcare decisions. What is it? Many of you may know that the UN has currently launched in 2016 its UN Sustainable Development Goals, which we are as a global community to reach within 2030. Moreover, I'm sure everybody has heard about sustainability or sustainable development. But how can we relate that to health and healthcare in particular? So, here we have my first slide. Health and sustainability, what is the link? And as you can see from the bullet points here, I want to take you through some definitions first. And we can start off by the first definition, which you can see here, which is by the WHO, the World Health Organization. The World Health Organization states that health is a state of complete and physical, mental and social well-being, and not merely the absence of disease or infirmary. This indicates that the WHO says that health is much more than the absence of illnesses, diseases, different pathological conditions. So health in the current regime is defined much broader than it used to be. It is also found at different scales. It's found at individual scales, that's you and me, our individual health. We have local health or community health, which is often considered to be at local levels, such as your city, maybe your municipality or local community. But you also have regional health, which would be, in our case, maybe the Nordic region or even the EU, the European zone. We then have continental and global health. A lot of you have probably heard about global health, which is also a scale at which health exists. And I want to connect these scales to sustainability. So if we look at health at these different levels, health has often been understood, as I say here, by a definition that is focused on the individual human being and the population here and now. That means, how can we, what is our health here and now? How can we become healthier in the very, very near future based on past experience? But sustainability, as you may know, also has to do with the future. That's why the UN has its Sustainable Development Goals set at the date of 2030. And then we can link this to health by saying, what about the health of the individual and society in the future? And what about the link between people, the environment, the economy, politics, and culture? And this is where sustainability comes in. As you may know, sustainable development has often been thought of in economic terms, economic development, foreign aid, but it is more and more often been associated with climate change, right? That climate change is looming on the horizon. We need to act now in order to save and safeguard the future. But what about health, once again? Since we've often defined health as a problem, individual problem here and now, we might also start thinking about how this affects our future health, that is, our actions here and now. So, as I said, the UN has its Sustainable Development Goals, the road to health for all, question mark. So, the Sustainable Development Goals are a set of 17 goals and a total of 169 targets that address important dimensions of health, climate, economy, education, and human rights that together must be achieved by all countries in the UN by 2030. So they are interconnected and think holistically about health. So what's further important is that each sub-target, that is these 169 targets, have an indicator that is used to measure progress towards 2030 and the goal achievement. And goal number 3 in the Sustainable Development Goals is called Ensure Healthy Lives and Promote Well-Being for All at All Ages. So once again, we see that the UN has moved in accordance with WHO to think more holistically about health. So it means not just, once again, disease or illness or pathology, but it means well-being, and for all ages. So here's a list of the goals in Goal 3. As we can see here, Goal 3.1 is to reduce the global maternal mortality ratio to less than 70 per 100,000 live births. And the list goes on. I, as a researcher, work primarily with Goal 3.3 to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases, which should be an appropriate goal to work on now that we're in the middle of a pandemic. But as you can see here, the list is long and there's a lot of health here. There's many health-related indicators that we're going to reach as a global community within 2030. And you might think that the list has ended here. But as I say, more targets. Here we're already at target 3.7, 3.8, and 3.9. And as you can see, these targets are pretty ambitious. Not only is it each individual nation that is going to reach these targets, but indeed it's the entire global community, and we have now 9 years to reach them. And you might think, well, 9 targets within 2030, is that a lot or is that a little? So, how are we going to reach these goals? And how can health professionals and people studying health help reach these targets? As we know, and as we already defined, we need to think holistically about health. It's no longer enough to think about individual health here and now and health just defined as disease, like heart disease or lung disease or infectious diseases. We need a new paradigm for thinking about health in health education. And that's what this slide brings me to. So how can we achieve these goals, and what is the role of healthcare professionals and the healthcare system? Well, as I write here, in order to better cover and reach the UN's SDGs, we can say that sustainable health education must be such that local health-related decisions must take into account future and global social, cultural, economic, and environmental implications. This means that we can't just think about the health right now of people and communities, but we have to think about their health into the future. But also, and this is an important point, we also need to think about the health of generations to come. This is probably also why we need to lower fossil fuel emissions, because not only will this drive climate change, but it will also lead to poorer health for future generations to come. My second point on this slide is that this warrants an educational paradigm shift, a system approach balancing individual immediate needs with current, global, as well as future issues. Already here we see that your health and mine is interconnected with not only global issues right here and right now, but also future potential issues that we either see on the horizon already, such as climate change, or antimicrobial resistance. For instance, in the case of antibiotic resistance. So what we need is, as I write here, a paradigm shift. And this might sound unachievable or difficult, but we do have some tools that we can implement, which I will come to later. So, sustainable healthcare decisions and education. What can our objectives be in order to achieve sustainable healthcare decisions and healthcare in general? Well, we need to educate globally anchored health professionals who make sustainable healthcare decisions without compromising future and global needs. That means in clinical settings, healthcare personnel needs to not only take into consideration the individual patient's health right here and right now, even though that is important, we also need to think about that person's health into the future and the larger system around that person. So here I've listed some key issues that needs to be taken into account. First of all, we need to take into account what's called EBM, or evidence-based medicine. I'm sure many of you know about this paradigm. It is the paradigm that all medical decisions and treatments should be based on solid scientific evidence, usually generated by randomized controlled trials. Examples of this would be, for instance, the recent COVID vaccine, or cancer drugs, drugs that treat HIV, etc. So that's one part of the puzzle. We need evidence-based medicine, but we also need to take into account the patient's wishes and needs. That means we also need, when we have our patients, be that in the clinic, in hospitals, if you are taking care of somebody at a nursery home, etc., we need also to take into account their wishes and needs. We can have as much evidence-based medicines as we want, but if we don't communicate with the patient and listen to their wishes and needs, they might not adhere to the treatment that we prescribe, or it might be difficult for them to follow medical advice. Hence, we need to listen to patient wishes and needs. This is one way of making healthcare decisions sustainable. Then we also need to listen to the broader culture. We're all embedded in a cultural frame, be that here in Norway or in another country, or even local cultures. This is also an important point. In order to make healthcare decisions that are sustainable, that is, they function here and now, but also into the future, we need to also take into account culture. Fourthly, we need to obviously also take into the economy concern. That means that while economy has often been blackballed as something nefarious, we do need to also find solutions that are economically sustainable for both the individual patient, ensuring equitable access to treatment regimes, but also the broader society at large. And then finally, climate and environment. We also need to start thinking about healthcare within the frame of climate policies. We need to start thinking about how hospitals pollute, or how medical businesses add to pollution and waste management. Well, does this sound like a lot? Maybe, but it's possible to achieve, and it starts with education. Some examples of sustainable healthcare and decision-making is here on this very screen. Antibiotic use is a classic example, like an example that many of you probably can relate to. And my main goal here is to tell you that we need to reduce consumption now in order to reduce antibiotic resistance in the future. The threat of antibiotic-resistant bacteria is looming large. We've already seen this in epidemiological studies, in hospital settings, and even in the community at large. Even though Norway still are somewhat sheltered from this, we see this as a growing global problem. So this is a classic example of sustainable healthcare decision-making. That means that individual healthcare personnel has to make an individually informed choice in a clinical setting where they prescribe just a tiny bit less about antibiotics to their patients without compromising their patient's health, while at the same time adding to less antibiotics, which is a good thing both for the individual patient, but also for us as a community, right here, right now, but also in the future. Climate emissions from hospitals and universities. We have to reduce climate emission and the use of plastics. This means turning to electricity, renewable energy sources, and reduce plastics. This is an emerging theme within research on hospital systems, where we're trying to find out how can we cut emissions in surgery theaters, for instance. The gases that are used in hospitals need to become more green. The same with transportation. We also need to focus more on preventive health. For far too long, medicine has been a sort of ad hoc technique, where we only look at the patient's health once it has deteriorated. What we need is a preventive turn in medicine, where we can ensure that people's health are solid and good for a longer time by fixing things that are preventable, such as lifestyle diseases. But as I write here, sustainability is obviously more than just health. It is entangled with financial issues, climate issues, cultural issues, and also human rights issues. So, how can we turn to education? This is my final part of this presentation. And there are 5 important and what we call generic competencies that healthcare professionals need in order to meet the healthcare demands both here and now, but also in the future. That is, once again, sustainable healthcare education and sustainable healthcare decision-making processes. And I've listed 5 competencies. We have system thinking competence, and by this we mean the ability to analyze complex relations between various social, economic, and environmental detriments and health outcomes. For instance, how housing conditions impact on the spread of the pandemic that we're now in, that is the COVID pandemic. So healthcare personnel, be that clinical doctors, nurses, midwives, but also policymakers and others that work in the field of medicine or health, need to start also think broadly about individual health issues in a more system thinking way. That is, a larger framework for thinking about health. We need what is called anticipatory competence. This might be a bit tricky, but try to follow me here. Here, we've defined anticipatory competency as the ability to picture possible future scenarios, both on the individual level, for instance, potential conflicts between treatment programs and patients' lifestyle, and collective level, for instance, the risk of overtreatment or unnecessary use of health resources. That means that healthcare personnel need to be educated in order to think future scenarios. We need to think about, for instance, antimicrobial resistance. That is a way of thinking the future, not just the here and now. But it's also the case with overtreatment. Should we always treat the patient, or is it okay to not treat a patient for some illness and reduce the use of treatment regimes? So anticipatory competence literally means to anticipate possible futures, both for the patient, but also for the community. We need normative competencies, and this one might sound a bit moralistic, but it's not. Once again, it is defined as difficult bedside priorities. For instance, how should treatment be given priority to treatment given limited resources, or to act albeit in the face of uncertainty. So this is important. We need guidelines, we need a framework to think about how to make difficult decisions in healthcare when there are limited resources, because there will be limited resources. In this case, we need healthcare personnel to be trained in making difficult decisions that both has to do with limited resources, but also uncertainty. Once again, the COVID-19 pandemic is a good example of these issues. And unfortunately, they are hard, they're there. There are resource-limited settings which will be difficult to prioritize. And the same with uncertainty. In the face of new threats to both human health, but also the health of the planet, we need to act even in the face of uncertainty. So healthcare personnel, like yourselves, need to be trained in making these decisions. And then strategic competency. I've defined this as the ability to supervise and lead peers and contribute to good health governance. This means that we need to start thinking about collaboration across disciplines. We need to get good programs for education. And we also need to think more about involving patients as active members of research, but also education. So strategic competencies is the ability to learn how to make strategic choices, when to collaborate with whom and where. That is kind of the part of strategic competencies, which has to do with making a strategy for your own education, but also for healthcare in general. These 5 generic competencies, strategic, normative, anticipatory, and system thinking, form what we call sustainable healthcare decision-making. And these are 5 competencies that I think all of you can learn. It's definitely a way of learning more about health, but it's also a way of thinking more holistically and about health in a broader picture. I would like to finish this presentation with saying that these 5 competencies obviously are also entangled. Anticipatory competencies, for instance, can also be part of strategic competencies. And the same with collaborative competencies, which is the ability, as I said, to work across disciplinary boundaries, to work in partnerships with patients and their relatives. Together, these 5 competencies form what we can call sustainable healthcare education, or also sustainable healthcare decisions, which is what we will need in order to reach the UN's SDGs within 2030.